now, how about we give you an option of how you can spend your money to make sure that you have proper responses when it comes to your joint and joint replacement, hip and knee. So especially if you're a sports person, I think you should jump in. And also if you are taking care of the elderly, pia itakuwa ni vizuri sana kuingia. We get to have a conversation with Dr. Sang Edward. Good morning.
Morning.
Yeah, I don't know how to introduce you with your title. Lebu introduce title yako because you're daktari, but when it comes to your title, muko na kizungu hapo. Just talk to us a little bit about it and what you do.
My name's Edward Sang. I'm an orthopedic surgeon specializing in hip and knee replacement, minimal invasive surgery, that's shoulder and knee, and trauma.
Yeah, just talk to us a little bit about your career. You've been in the business for like 13 years. How's it been so far, the interaction so far with what's going on? And of course, what are the prevalent ages of people who suffer shida ya magoti na hip?
Basically, for hip and knee replacement, they're elderly patients. 90% of our patients are elderly patients. Patients from the age of 60 onwards. That is if they have arthritis that is related to age. But we have a small percentage of arthritis that's caused by trauma and other autoimmune diseases. There's some diseases that you're born with that can predispose to arthritis. But for the minimally invasive surgery, like the knee and shoulder arthroscopy, normally we deal mostly with sports injuries, like in the footballers, in the rugby players, shoulders, basically in the elderly population.
Yeah. I think we're always talking about, I want to find a good doctor. We can also be good patients as far as making sure that we're getting the best possible out of our healthcare, right? What is the most, I think, common mistake that patients make, whether, and not just with a specificity to orthopedics, but in general, whenever they're going to get checkups or healthcare of any form?
I think the commonest I've seen is Dr. Google. As in, everybody goes to Google, then you're like, I'm dying.
WebMD,
so bad.
yeah. You tell WebMD I have a headache, and it's
Google
like, and you have 10 days to live. You're like, hey, what's going on?
I was having a bad headache, and the options were like, you cut off your head. I'm just like, I don't think that's something I should do.
Because Google is just open. It will give you, whatever you ask, it will give you, and it's not regulated. So I think the most important thing is to go to a reputable hospital. As in any other business, we have con men out there, but I'm sure there are a few reputable hospitals. There are many reputable hospitals in the country, even the government hospitals. Then from there, you'll get the doctors, well-trained doctors, because in our profession, there's a referral system. It's very difficult for you just to wake up and say, I'm going to see an orthopedic surgeon, unless you know specifically this problem is related to an orthopedic surgeon, because there are like more than 30 specialties, as in their skin specialists, their heart specialists, their kidney specialists. So normally the general doctors, if you go to a small facility, you could see a clinical officer who will now escalate the issue and send you to a medical officer who will now look at you and say, probably with your problem, you'll need to see a consultant. Then you're sent either to an orthopedic surgeon or or the consultant who will sort your issues out.
There's something that I've always wanted to know. There's a lot of patients who usually go through a phase and they don't have like proper education they don't have patient education about what's really going on, and of course sometimes the caregivers don't have an idea on what they're actually treating or what they're handling. How best can one get information about how their body is coping, maybe in such a situation, maybe before surgery and after?
I think now that narrows down to the specific issue. Like normally the most important thing is getting the relevant information. Relevant information you can get from the primary caregiver, the doctor you go see. And then there's also something called a second opinion. Because most of the time, there's a time you go to a doctor, you talk to the doctor, but personally you feel that there's something wrong, as in you're not getting it, or you're not in sync, or whatever you've presented to the doctor is not what it's basically you're not getting what you were expecting. Then it's always advised to seek a second opinion from a second or a third doctor. It never hurts. The only thing is you could spend a bit more, but eventually if you see 2 or 3 doctors, at least you'll get the right treatment.
Especially, second opinion.